Do you want to know how to last longer in bed? I'm Dr. Emma Blake, urologist, men's health expert, and here to help you take control of your performance and confidence in the bedroom. Today, I'm going to show you what actually works to last longer during sex, whether you're struggling with premature ejaculation or just want to improve stamina and control. And yes, we'll talk about both natural strategies and medical options. But more importantly, I'll help you understand why this happens in the first place. Let's start with the truth. The average time from penetration to ejaculation is about 5.7 minutes. That's the global average. So if you're around there and you and your partner are happy, there's no need to fix anything. But when researchers ask couples how long they'd like sex to last, the number jumps to around 7 to 13 minutes. That gap is where frustration, insecurity, and pressure can start to build. So let's be clear. You don't need to meet anyone's expectations but your own and your partner's. And part of that is understanding what they actually want. Many women care far more about connection, foreplay, and intimacy than penetration time. Manual stimulation, oral sex, and sexual tools can all bring just as much, if not more, pleasure. So talk to each other. That alone can transform your sex life. But if you do want to last longer, especially if your climax feels too quick or uncontrollable, then what you're likely dealing with is premature ejaculation. In medicine, premature ejaculation is defined by three things: ejaculating within 1 to 2 minutes of penetration, having trouble delaying ejaculation almost every time you have sex, and feeling stressed, anxious, or frustrated because of it. If you've always experienced this, it's called primary premature ejaculation. If it started later in life, after previously having normal sexual function, that's called secondary or acquired. One common cause is related to a chemical messenger in your brain: serotonin. Certain receptors in your brain that are supposed to delay ejaculation don't work as effectively in some men, which can cause the reflex to kick in too quickly. Yes, ejaculation is actually a reflex, like sneezing. It's controlled by your spinal cord and brain. When the nerves in your penis are stimulated, especially by friction, they send signals to the spinal ejaculation center. That signal is then modulated by your thoughts, emotions, and brain chemistry. So what can you do to regain control? Let's start with natural strategies. Because for many men, these are not only effective, they're empowering. The first is sex therapy, or cognitive behavioral therapy. Anxiety, guilt, and performance pressure are huge drivers of premature ejaculation. Addressing these through therapy can improve performance dramatically. In fact, studies show that combining therapy with physical methods can increase stamina by up to 8 times. You can also try what's called the stop-start or squeeze technique. When you feel close to climax, stop all stimulation or apply gentle pressure to the shaft until the urge fades. Repeat this cycle 2 to 3 times before allowing yourself to ejaculate. Over time, this helps you build more awareness and control. Pelvic floor physical therapy is another game changer. Your pelvic muscles play a direct role in ejaculation, and training them through specific exercises, like Kegels, can help delay climax. A specialist can guide you through proper technique. Now, let's talk about medical options, starting with topical anesthetics. These are sprays or creams that reduce sensitivity in the penis, giving you more time before climax. They work by decreasing the amount of sensory input reaching your spinal cord. The most well-known is lidocaine-based sprays. In fact, clinical studies show that men who used a delay spray increased their average time from 6.5 minutes to 11.5 minutes, nearly doubling their performance. One of the most researched delay sprays was tested on 195 men. The study found that, beyond lasting longer, the rate of orgasm for both partners went up significantly, from 44% to 66%. That's a major boost in satisfaction. Prescription options include Iamla cream or Fortisson spray, commonly used in Europe. These also contain numbing agents and are applied 10-20 minutes before sex. However, They can sometimes cause numbness in your partner if not washed off beforehand. The next treatment category is antidepressants, particularly SSRIs like sertraline, fluoxetine, and paroxetine. These work by increasing serotonin levels, which helps delay the ejaculation reflex. While not officially approved for this purpose, they are commonly prescribed off-label by urologists. They typically take 1 to 2 weeks to show full benefit. Side effects can include fatigue, nausea, or reduced libido, so they're not for everyone. There are also fast-acting medications like clomipramine or duloxetine, outside the US, that can be taken a few hours before sex to achieve a similar effect. Some men also find benefit from medications like tramadol, an off-label option used for pain, but known to delay ejaculation. However, it carries a risk of dependence and should be used cautiously. Another medication category includes alpha blockers like tamsulosin and silodosin, often used for prostate issues. Silodosin in particular has shown promise in delaying ejaculation, but may reduce semen volume and require a prescription. Lastly, don't overlook the connection between erectile function and premature ejaculation. If you're struggling with maintaining a firm erection, that performance anxiety alone can rush climax. Medications like sildenafil or tadalafil, commonly known as Viagra and Cialis, can help address both issues at once by improving blood flow and confidence. Now, if you're looking for a natural daily way to support sexual stamina, this part is important. Watermelon contains a powerful compound called L-citrulline. Inside your body, L-citrulline converts to L-arginine, which increases nitric oxide, the very same molecule responsible for relaxing blood vessels and improving blood flow to your penis. That's why many men are now turning to watermelon extract as a natural performance booster. But not all supplements are created equal. If you're looking for one that's actually bioavailable, meaning your body can absorb and use it effectively, the one I recommend is linked below in the description. It's a clinical-grade watermelon supplement with a standardized dose of L-citrulline, designed specifically to support erectile hardness, blood flow, and endurance. And yes, many men report improved control and stamina within weeks of consistent use. So if you're serious about lasting longer, don't just chase quick fixes. Combine science-backed tools, train your body, and give it the support it needs. Then you can find the link in the pinned comments below to try the watermelon supplement I recommend. And give yourself the edge nature intended. And remember, your pleasure, your performance, and your confidence are worth investing in. Take care of your health. Take back control. Dr. Emma Blake.